Hello, everybody. This is Heather Korbulik. I'm the Executive Director with the Silver State Health Insurance Exchange. Thank you for joining us today. It is 3 o'clock, so we're going to go ahead and get started, and I'm sure others will join us as we go along. As general housekeeping items, I want to remind everybody that we record these meetings on our website on a page called the Broker Transition page, and I'll show you a picture of that later in this presentation. I also wanted to let you know that this meeting is being recorded, and we would really appreciate if you would please mute your microphones so we can ensure that everybody has a high-quality experience. Again, I wanted to apologize for the quality of our last presentation. I did go back and re-record the content, so if you did miss that presentation, it is updated on that website with the updated recording with much better sound quality. So with that, let's get started and kind of give you an idea of where we are. Something's a little slow here, just give me a minute. There we go. All right, so our agenda today, again, as usual, we're going to give you some introductions of the SS-HICS, or the Silver State Health Insurance Exchange folks who are on the phone. We're going to talk about progress to date on our project as it relates to technology and our call center implementation. We'll talk about designated agents and brokers and the Exchange Enrollment Facilitator service line. We'll talk about our MindFlash training curriculum and certification along with our account profile setup. We're going to get into entity training and profile setup, and then our EEF training or Exchange Enrollment Facilitator training, and some of that is coming soon. We have a discussion on how to designate a broker prior to open enrollment, how a consumer can go about doing that. Then we're going to talk about designating a broker if you were one of our returning brokers who did not make it under the deadline window and are going to have to repopulate your book of business. We're going to give you some information on how to do that and point you to a resource that we've put together that should be helpful when you go about doing that. We're going to go over our key dates and talk about our soft launch, which is next week. Oh my goodness, here we go. We're going to talk about window shopping, and then our Broker Connect tool, talk about consumer communication, key dates as it relates to that communication, and get into some Q&A and offer up opportunity for more Q&A. Again, I'm going to remind everyone, because I've heard some new people join, that this recording or this meeting is being recorded, and that we would appreciate you putting your microphones on mute. And I know that some people are chatting at the same time. It is really hard for me to make sure that to manage both of these things. So just bear with me, and I'll look at your chats after I get through some slides. Okay. Going on into who's on the phone with the Silver State Health Insurance Exchange. I got just a little delay on the slide advance, so please bear with me. So on the phone today, I hear lots of people joining us, so again, I'm going to remind everybody, and I apologize for the repetition, but please mute your microphones, and remember that this is being recorded and will be posted to our website. Today you have, from the Silver State Health Insurance Exchange, you have myself. I'm Heather Korbulik. I'm the Executive Director. In my office, we have Ryan High. On the phone, we have Rosa Alejandre, who is our Navigator Program Manager. Rebecca Lamazzo is our Broker Liaison. Janelle Davis is our Communications Manager. We have a new addition to our team. Her name is Katie Charlton, and she's our Information Technology Analyst. Eric Watt is our project manager, and Athena Cox has been promoted into a new role with the Exchange as our quality assurance officer. So a high-level update on where we are with our transition project. Lots been happening throughout the month of August. We have been working with our carriers in the back end of the Get Insured platform. They're going through plan preview, so they're looking at all of the details of the plans that they've submitted that we have then certified, and they're making sure that the data that we've transmitted into that system is accurate. So that's going through September 6th. Our carriers, some of our carriers have completed their electronic data interface testing, and some are ongoing and will be wrapped up here shortly. We also have another release for our user acceptance testing, and that will happen on August 28th or tomorrow. And Get Insured has received all of the application and enrollment data files from CMS on August 15th. So they're working to migrate that data into the Get Insured platform, which will also result in the migrated book of business for our brokers and enrollment professionals. And with an asterisk there being those enrollment professionals who finished their training by August 9th, as per our many, 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 many emails and phone calls and reminders. Our call center is up and running, and we have our enrollment professional service line available to you at 1-800-547-8156. And again, that's a specific line available to brokers and to enrollment professionals who are partnered with the exchange. That's not a line that we are promoting. We will be promoting the Consumer Assistance Center number, which has changed. And I'm just going to give it to you, and it's going to be all over our webpage starting on September 4th. But that number is 1-800-547-2927. And that's our consumer assistance line. But the broker number that we're displaying right now, 1-800-547-8156, is for the use of our enrollment professionals and their technical support needs. It will be open through open enrollment and ongoing. We have our IVR and our Broker Connect tool being tested and ready for implementation and production on September 4th. Again, that line is open and active, and we have Get Insured, our call center representatives through Get Insured doing assistance for brokers who are working on creating their accounts, who may need technical assistance or who may have questions about that process. So again, you're welcome to call them at that line anytime. The call center hours for brokers during open enrollment will be Monday through Friday, 9 a.m. to 7 p.m., and then Saturdays, 10 a.m. to 3 p.m. Our broker support line during special enrollment period or anytime outside of open enrollment will be Monday through Friday, 9 a.m. to 5 p.m., and it will be closed during Saturday and Sunday. A lot has been going on and continues to go on in terms of certification, training, and setting up accounts for our brokers and our enrollment professionals. All of our returning brokers were required to finish their training by August 9th in order to have their book of business migrated. For those of you who may not have met that deadline, that training and certification is still available to you. However, we will be unable to migrate your book of business, and we'll get into that a little bit more in a minute. But we sent an invite with training for new brokers and our exchange enrollment entity points of contact. It was sent from the Nevada HealthLink training team on August 19th. We're getting set to send another reminder to all of you who may not have opened that email yet. We are really, really, really encouraging you to complete that training and get your account set up in time for our soft launch on September 4th. That way we can be sure, and you can be sure, that your name is a part of our directory and is listed in the Broker Connect tool on the IVR system. Once you've finished and completed your training in MindFlash, you're required to go to the Get Insured system and set up a broker profile. Again, our call center can help you with that account creation, and we've given you a little hint here in this slide that just to expedite the process, you can go ahead and press 5 for technical assistance to get your account set up, and then if you need assistance from the exchange, you can press 1 and you'll get connected right to our exchange staff who can help you with MindFlash. Our navigator and in-person assisters and their points of contact were invited to take the training and establish their entities on the Get Insured system. That is a different and more complex process than it is for brokers and agents. So Rosa Alejandra, who's on the call, is more than happy and has probably been in touch with all of you entity points of contact, and we really need you to get that done here shortly so that we can finish up and get your accounts created, and then also get your EES on staff into that system and trained. We did set a deadline for trainings for the new brokers. We've set a deadline of August 1st, but again, we really want you to be completed by September 4th so that we can begin letting consumers expose your information and your contact information to consumers, and we'll talk a minute about that, more in a minute. Navigators and IPA points of contacts, you must finish your training by September 1st. Okay, so there have been some questions, and so we wanted to kind of make sure we address this in this presentation, and again, wanted to let you know that Rebecca Lamazzo is on the call and available for any kind of questions you might have, as is our call center. But in order to designate a broker prior to open enrollment, consumers have to have an account. So I'm going to back up a step and just remind everybody that on September 4th, we're going to be inviting all of our consumers to activate or claim their accounts on the Get Insured system or with Nevada HealthLink. They'll be receiving an email with a very specific code that will be asked to input, and that code will allow them to set up their account. For consumers who are returning and who activate or claim their account, they will have two different options. If they have not already designated a broker to work with, then they will have an opportunity to designate a broker during this soft launch period. So between September 4th and October 11th, consumers will have the ability to designate a broker if they don't already have one. If they do have a broker, then that option will not be displayed for them. For consumers who have not opted into auto renewal, they will also have an opportunity during this period to opt in and choose to be auto renewed for plan year 20 and then ongoing. So we wanted to provide a little bit of information here about how a consumer can designate a broker prior to open enrollment. And these consumers cannot be new consumers, they must be returning consumers who already have an account. They do not need to have an application, but they do need to have an account. So consumers and brokers are, this is just a bit of the workflow. I promise to try to zip through this because it's pretty wordy, and this training is available online for you to review if it's of interest to you. Consumers and brokers were populated, their book of business were populated. We migrated all of that information from healthcare.gov, and new consumers will not be able to create accounts until November 1st when open enrollment starts. If an existing consumer already has that agent or broker of record, then that will carry over, assuming that the broker got certified prior to the August 9th deadline. So once that consumer with a designated broker logs in, they will not be able to change that designation, but the consumer will be able to designate a new broker during open enrollment should they choose to do so. If an existing consumer already has an agent or broker record, but that broker is not certified, meaning they did not get their training completed by that August 9th deadline, they will not have a broker designated in the platform, and that person will have an opportunity to designate a certified broker in the Get Insured platform. If an existing consumer had no broker of record from plan year 2019, they will also be able to designate a certified broker in the Get Insured platform starting on September 4th. So this is a step-by-step instruction on for those of you who may have missed the the migration period or the returning broker deadlines to get your book of business migrated. We did create some step-by-step instructions on how you can walk your consumers through the process of designating you prior to open enrollment. And I'm going to take just a quick second here and show you on this page. This is the website that houses all of our meetings and recordings, and I'm scrolling down to near the bottom. Right here is broker guidance for building the book of business. This is something that we've put together for all of you, and this is where you can find step-by-step guidance to walk your consumers through the process of activating their account, setting up that login, and then you can find step-by-step screenshots of how to get them to designate you specifically for Open Enrollment 2020. All of this can be done between the period of September 4th through October 11th. So this link is the same that you've used in the past to get to our recordings from the meeting. It's nevadahealthlink.com/partners-transition. And these are the step-by-step instructions. I'm not going to go through that because it's not relative to everybody, but just wanted to let you know that that information exists, and we're happy to provide any additional assistance if you have questions. So some key dates that are coming up. We passed the August 19th date, but again, we sent out invitations to about 220 brokers who were considering new. Those are the folks that did not do any enrollments on healthcare.gov during open enrollment for plan year 20. And so that is available to those folks who have expressed an interest. And we have also uploaded some broker onboarding and certification guides back on that same website I just showed you. Of course, September 4th is a really big day. It's 1 week from tomorrow. We will be soft launching the exchange and just really inviting returning consumers to come and claim their account. I would love to have our partners that are on the call now and who may listen to this recording later on assist us with making sure that consumers get the word or get the notice that we would really like them to claim and activate their accounts during September through October, because that will help decrease the burden on our call center during open enrollment, when we really want to be focusing on ensuring consumers have access to information about open enrollment. We really want to be focusing on getting consumers connected to plans during October and November and December during open enrollment period. So any assistance you can provide us with getting people in there and activated, we would very much appreciate. So during this soft launch period, you will be, I went a slide ahead, sorry about that. Returning brokers will be able to log in and verify their book of business that's been migrated from healthcare.gov. This is going to be repetitive for those of you who have been tuning in for the last several months that we've been having these meetings, but I am not going to shy away from putting a giant asterisk on this section of our presentation. The book of business migration is going to only be as good as the data that is in healthcare.gov. So if your data on healthcare.gov is not an accurate reflection of the book of business that you've done, then please know that we are not psychic and we will not have access to that information. That broker onboarding, or that notification that I was showing you on our website, that guidance to build back your book of business, is going to be critical for those of you who may find that there is not complete, or you don't feel like everybody who is who you've assisted is reflected in that migrated data. Effective on, I wanted to also point out that on September 4th, consumers are going to only have access to very limited information. It's going to be for those people who have not designated a broker. They'll have an opportunity to do that then. And for consumers who have not opted into auto re-enrollment, they will have the option to do that then. They will not be able to access or see any of their application or enrollment data, and that is per CMS's requirements. They will not allow us to have consumers looking at that information until open enrollment. So any consumer who needs to make a change to their plan year 2019 application or enrollment needs to do so through healthcare.gov through October 31st. The next big date is October 3rd. We'll be opening up window shopping and allowing for consumers and brokers and all of our enrollment partners to take a look at all of the plans that are going to be available, the prices associated with those plans, and have the opportunity to do some anonymous plan comparison. I think this is a wonderful opportunity for all of the enrollment professionals who are on the phone, not only to give yourself a pretty good understanding of what's going to be available for the consumers that you serve, but to really start thinking about your individuals that you service and what might be best for them for plan year 20. October 15th through October 31st is when we will be freezing the opportunity for consumers to make any changes after they activate their accounts. And I'm going to go back and say consumers are invited to activate their accounts from September 4th going forward. That will not stop. But the ability to make changes to designate a broker or to change their options around auto re-enrollment will be frozen on October 11th in order for us to be sure to get the auto renewal batch jobs completed without error. So October 15th through the 31st, kind of on the back end of our work, we will be running those batch jobs, and those options to designate and to auto-renew will be frozen. And then, of course, on November 1st, open enrollment begins, and consumers can log into their accounts, hopefully that they've already activated and claimed, and begin making modifications to any application data, submit new enrollments, and then new consumers will be able to log in to their user and create user accounts during that time. I'm going to pause here because I see there are some chats, and I'm going to try to run through them before I move on. Okay, so somebody is saying that the link on Nevada Health Link with the instructions isn't working. I'm sorry. If you could just tell me exactly what link you're talking about, I'll be able to respond. There's another question about, is there a flyer we can send to consumers to tell them how to log in and claim their account? We'd be happy to put something like that together. Oh, Janelle said that we fixed that link. I'm sorry. And going back to this other question, yes, we will be happy to send you some information to provide to your consumers about how they can log in and claim their account. We basically got that all created. We do have a plan, and I can show you on the next slides on how we're going to be communicating that to consumers. But we're happy to put something like that together. So thank you for that, and we'll post it to that broker resource page that I showed you earlier, and make sure that you're aware. How will the brokers be listed for clients who want to assign a broker? Will brokers be listed in the same order as they are on the site? So if we go back over here, and I can show you again this, you'll be able to see that when a consumer logs in during this limited window of being able to designate a broker, I'm sorry that this is sort of small, but what they'll see is this: get free help, and then they'll have the ability to auto-renew, as you can see down here with that consent. So they can click on that Find Free Local Assistance. They'll be taken to our directory. We'll encourage them to press on the, you can encourage them to press on the certified agent or broker. Then they can search you by name and or by zip code. So if it's somebody who doesn't have a broker, never been affiliated with one, they can search by zip code and get a randomized list from that. But once they have searched your specific name or within that zip code, they'll have a list of those brokers available to them. They can select the one that they're interested in working with, press continue, and then basically accept or attest and agree to that designation. Once that designation is submitted and confirmed, then they get this screen, and our brokers are able to log into their portal, click on the individual tab, go down to pending requests, and once you're in there, you'll see the list of people who are pending. You can go over here and accept that designation, and you have completed the process. So again, that information is available to you on this website, nevadahealthlink.com/partners-transitions. I'm going to go back because I saw one more chat and I wanted to make sure that we, okay, so I think we've covered all of the questions for now, and I'm going to move on to the next slide, which is about the Broker Connect tool. Broker Connect is a program that is for brokers who have opted in on the Get Insured profile setup to receive referral calls. This is basically a telephonic Broker Connect platform, and if you have opted into that on the Get Insured platform, you checked the client served box. Again, you can log back in there and check that box now. You can uncheck it anytime you want. You can turn that on and off at your convenience. We wanted to, again, make sure everybody on the call knows that the calls are always going to come to you from this 1-800 number, 1-800-547-2927. So please make sure you add that number to your contact. Your phone will ring for 10 seconds or 3 to 4 rings before it gets transferred to the next broker in line. So when you're receiving those Broker Connect calls, please make sure you're picking up as fast as possible, because we don't want to lose the lead, but we also want to make sure consumers are getting the service that they're looking for. We encourage you to use your mobile number. So in your profile on the Get Insured platform, we encourage you to use your mobile number so that the Broker Connect tool is not directed to your IVR system in your office. We don't want consumers to drop off the call. We really want to connect them directly with you. So again, to make sure you're included, please go into your profile and click on the client served. And then make sure you're very clear on your hours of availability, because the Broker Connect tool will only be reaching out to you during those hours. Also wanted to make sure you know that this is only available for certified agents and brokers and is not available to our exchange enrollment facilitators or to the CACs. All right. So in terms of consumer communications, I'm going to give you, this is a little bit of a tip of the iceberg, if we will, on the massive amount of communication that we have planned to get in touch with consumers, not only specifically about our transition, but into open enrollment and getting them connected to plans and completing their application. So on September 3rd or thereabouts, the Centers for Medicare and Medicaid Services are going to be sending out a mass hard copy or snail mail letter to every Nevada household. This letter is going to be making clear to them that they are Nevada HealthLink is now the only place to shop for plans for plan year 2020. It will also let them know that any kind of issues with plan year 2019 or backwards need to be handled through healthcare.gov. On September 3rd in the evening, kind of later in the evening and into September 4th, we will be sending out the emails inviting consumers to claim their migrated account. Because that email is going to so many different people, we're sending them in batches, and so some of those batches will begin on the evening of September 3rd. Again, the consumers will be invited to claim their accounts. They're going to be asked to opt into auto re-enrollment and designate a broker and agent if they do not already have one. The call center, of course, will also be active and live and available to consumers on September 4th. On the 17th through the 24th, we will be hosting a series of open enrollment prep sessions. There will be 3 sessions offered, one at 9 to 10:30, one from 3 to 4:30, and one again from 5:30 to 7 p.m. each day on the 17th and on the 24th. On the 17th, we will be in Las Vegas at City Hall, and then on the 24th, we'll be at the Innovation Center in Reno. You should be receiving invites any minute now, and so please save those dates and the time that's most convenient for you. We're going on a road show and trying to make this extremely convenient for you so that you can get the information you need to help service consumers for open enrollment. During the month of September, Nevada HealthLink is not only going to be we're going to be sending reminders to any consumer who has not yet activated their account. So we'll be working very hard to drill down into our new data. We're so excited about having data on who our consumers are, and we'll be working with that data to get in touch with consumers who have not yet activated their accounts. That's going to be a weekly reminder, but again, I will just emphasize to the enrollment professionals on this call, we really would appreciate your help in making sure that consumers get that word. October 1st is another opportunity for us. We're going to resend the email to consumers who have still not claimed their account. We'll send the email and the activation code, the same activation code that was provided to them on September 4th. Any consumers whose email address bounced back, meaning that when we sent them their invitation to claim their account on September 4th and somehow their email no longer exists or it bounced back to us, we will be sending that notification via mail. So again, this is, it says here October 1st, but October 3rd is the day that SBE platform will be available for window shopping. October 1st is the date that consumers will get the second round of activation emails if they did not already activate or claim their account. Like I said earlier, on October 11th, we will be freezing the platform to be read-only for those migrated consumers, but we again are encouraging them to continue to activate their account. They'll still be able to do so. They'll just once they log in and get through the claiming their account, they'll just get a thank you, take a look at the plans that are available, and come back October 1st to make any changes and to enroll. October 15th is when we start that auto renewal process, and then of course open enrollment is November 1st through December 15th. We have been working really hard on a campaign that I'm pretty excited about. The theme is called the Peace of Mind campaign. If you come to our prep sessions in September, we hope to be able to show you a clip of that campaign so that you can know what that advertisement will look like for this next plan year. I'm going to pause again because I can see that somebody chatted, and I just want to make sure I'm answering everybody's questions. Is this information available on Nevada HealthLink portal? Yes, it is. And that information is on that page that we talked about, again, nevadahealthlink.com/partners-transition. And I see that somebody indicated that they felt like that was a lot of steps for your clients to go through to designate a broker. I know it looks like a lot, but we've got one of our training specialists working on just a video for you. 13 steps is pretty small in the grand scheme of things, and so I would say that once you see the video, you'll see how straightforward and pretty intuitive this process is. All right, so going back and just a couple more slides here. Sorry, I have a little bit of a delay. Oh, okay. So we did get a question from a broker asking us, or saying that the federal marketplace prohibits brokers from signing on to the marketplace on behalf of the client, even if the client gives the permission to do so. Will the Nevada HealthLink marketplace be the same? And will the client have to log in and then a broker can assist? So I'm sorry that the formatting got a little wonky here, but brokers will have more autonomy on the Nevada HealthLink platform than the federal marketplace. And that autonomy comes in the ability to act as a proxy for your clients. A broker can click on any consumer on the broker's active individual screen and go to the member portal to complete that consumer's application, shop on their behalf, and even update their demographic information. Additionally, brokers have the ability to start and complete a new application for a consumer and be auto-designated to that consumer. So the agent can complete the entire flow on behalf of a consumer, including creating the consumer's account, completing the application, shopping for, and then enrolling the consumer into a plan. I'm going to I see a couple more chat questions, and I'm going to leave this contacting the exchange information up for you to view, and I will go and answer the questions. Yes, we will work on creating a flyer for consumers, or for you to share with your consumers, and you can make sure to get that information out to them. We really appreciate that interest and look forward to working collaboratively with all of you in making sure that consumers get the information they need to claim their accounts prior to open enrollment, and then connect with you during open enrollment to get connected to our plans. I know we didn't cover this in the slides, but did want to just remind everybody that it's looking like we will have 3 qualified health plan carriers and 6 dental carriers for plan year 20. All of that gets locked in at the end of September, and we look forward to being able to announce that final information. For right now, it's looking like 3 QHP carriers, 6 dental carriers, and 26 QHP plans. The other thing that has been encouraging is that the proposed rate increases are about 0.5 percentage point of increase on the average. So signs of some stability and some pretty good news for consumers who are returning and new consumers this year. Those rates will be finalized on October 1st, and you'll be able to see in the exchange platform when you do your window shopping what those rates look like for you and your consumers. I got another carrier. Who are the carriers? We have Health Plan of Nevada, Silver Summit, and Anthem. And again, those will all be locked in by the end of September, and so everything is temporary until those contracts are signed. And then another question, will the dental be separate from medical in respect to if an enrollee terminates dental, it will not affect their medical enrollment? That is correct. And something that may be of interest to folks on the call today, the consumers will be able to purchase standalone dental plans without purchasing a qualified health plan, which is new, and that functionality is not available on healthcare.gov. They can do that by basically completing the application. We do have to do a hub check, meaning we do have to verify their residency, and then we'll be able to, you can log into dental plans rather than medical, and they can directly purchase a standalone dental plan that way. I got another question. Are brokers identified and attached to client via NPN? Yes, correct, they are. Is there a field on the consumer application where the broker NPN can be entered? There is a field in the application where a broker can designate a consumer can designate a broker. Again, if you are in your portal as a broker adding an enrollment, then that information should be there, but again, you'll have the opportunity to put that information into the application for the consumer via proxy and help them ongoing from there. All right, I see that we've got a slowdown in questions. Hopefully we've answered people. Oh, one more. Can the standalone dental plan be purchased outside of the open enrollment period? Unfortunately, that is not an option right now, but I like that thinking, and that's definitely something that we'd like to work with our dental carriers to figure out a way to do, but for this open enrollment period, that will not be available. I'm going to pause just for a minute and see if I get any more questions. And I want to remind everybody on the call that this presentation will be recorded and saved. We will send you an email if you attended and send you the link to where that is saved. Somebody asked me if they heard me correctly that Anthem is back, and I'll say that Anthem is intending to be back, but contracts are not signed until the end of the month, at the end of September, and so until then, nothing is solid. Once we get contracts solidified at the end of this month, we will make sure to make an announcement about that. But yes, Anthem has submitted plans, qualified health plans, for all 4 of our rating areas, so the entire state, and that is another opportunity for consumers in terms of competition and finding plans that are right for their individual needs. I'm going to also just plug that those plans, if they all stick and we get everybody signed on and contracted for September, in the end of September on October 3rd, they will be available for you to view, and you can take a look at how much they'll cost and where they are and all of the specifics at that time. All right, I'm going to wrap and just again thank everybody for your time and questions. Please don't hesitate to reach out. I've included on this slide that you're seeing now the contact information for Rosa, who does our Navigator program management, and our broker liaison, Rebecca, who has been busy, but is more than happy to hear from you. And I also included Ryan High, who's our Chief Operations Officer. So please don't hesitate to get in touch. We like hearing from you. We like your feedback. Keep it coming. We're looking forward to partnering and having a successful launch here come next week. Thanks again for your time, and take care.